Yes, I think that is the case. We did end up with, obviously, publicity when we had celebrities diagnosed with cervical cancer. We saw the fact it was in the media. We saw a big increase in uptake of cervical screening. Now, of course, that's old news now. And again, what we are seeing is we're seeing less women coming forward for their screening on the screening programme.
Why do you think that is?
I just think that if it's not talked about and it's not in the public light, it becomes played down and the importance is forgotten about.
How can you hit the realities home to people? Because if nothing else, it's a sensitive topic because it's a sensitive area and it's a sensitive... People don't want to talk about it.
No, people don't want to talk about it, but I think it's something that has to be, again, initially brought up in schools. I think that women are, and boys as well, are being more open, talking more openly about sex and about sexually transmitted diseases. And now, of course, I think it is well recognised that human papillomavirus, HPV, is the cause of cervical cancer, and it is a sexually transmitted disease. And women who are sexually active should be having their screening, and certainly now, more importantly, we should be looking at vaccination, of course, of teenagers.
You talk about things like HPV. It is the cause of cancer. That's pretty scary for somebody going in or having that letter, for example, for the first time to go and have their screening test. Could the fear of it coming back in a bad way put people off, do you think?
It is a possibility, yes, that it is the worry that they don't want to have a test done because they don't want to find out the answer. However, the one thing about cervical screening is we're not looking for cancer on a cervical smear. We're looking for changes that may have left untreated and undealt with go on and cause cervical cancer in the future. We know it is a slow progression from mild changes through to actually having an invasive cancer. And screening and regular screening, and that combined with vaccination widespread to both boys and girls, could eradicate it as a disease.
So what happens? It's around the age of 25, isn't
Yes.
it? So how is this introduced? Because there will be plenty of people that just don't know about it until they get their
They'll
letter.
get their letter, yes. I mean, that is it. It is an age-related screening programme. At the age of 25, you will get your letter through the post, which will invite you to either attend your nurse at your GP's for your screening, or there's also a Stay Well clinic, which is run in the evenings at the hospital on a Monday and a Thursday, where women can attend to have their first smear. But I think it's that prospect of the first smear is actually probably quite a daunting thing for many women. And I think that it is managing to capture the women for the first smear that is the most important thing, because if you don't go for your first one, you're not going to go for any.
And is it painful?
No, it's not painful. And I think that's something that is actually very important, to do your absolute best to make that first smear not a painful experience. And the problem is that you can make your smear painful, certainly, because women are going to be anxious, they're going to be tense, and then actually putting a speculum, which is the instrument that we use to look at the cervix, in is very difficult, and it can be a struggle. And I think that the one thing, though, that healthcare practitioners are well aware of is that first instrumentation, that first putting in of a speculum. You cannot afford to make that a painful experience, because if the first experience is painful, again, you won't come back for it.
And how often do people have to go back?
What you're looking at in terms of the screening programme that we have is we're looking at 3 yearly smears from the age of 25. Now, if we do pick up on a smear, because now the screening programme has changed. Now what we're looking for as a primary test is we're looking for HPV virus. And if women have HPV virus, that does put them in a higher risk. And as such, they would be looking at having a smear every year. So if you have a negative smear, you will be on 3 yearly recall. If you do have HPV as the primary screening test, but with no abnormalities in the cells, then you would be on a yearly recall.
Typically on the Isle of Man, would you say it reflects what it's like in the UK? How many people would you say take their smear straight away or book their appointments when they get that letter? Do you have any idea of...
I don't, but my letter's still sitting on my desk. I think that we've seen a fall off, certainly on the island. I suspect it is reflected in the UK as well, but we are seeing less women coming for that first recall. I mean, obviously what happens with it is a computer generated system. If you don't attend for your smear, you will get a recall letter, but nobody's going to go around to your front door and knock on it and say, I've come here to take your smear.
It's not compulsory?
It's not compulsory.
Do you think it should be?
No. Nothing should be compulsory.